COVID-19, the coronavirus, it's impacted all of us. Each and every one of us has had to make changes in our lives because of this terrible disease. Here at Clark & Associates, we've had to make some adjustments as well. The United States Department of Homeland Security, as well as the state of Iowa, have designated us as healthcare providers an essential business. In light of that, we're trying to maintain our normal hours and our normal business activities. To do that, we've had to make a couple of changes. We need to be sure that the patients, their families that come in, and our staff are as safe and secure as they can possibly be. So, prior to your appointment, we're going to give you a call, and I'm going to read these questions so you know what's coming. We're going to ask you 4 questions. The first one is, have you traveled outside the state of Iowa in the last 14 days? The next question is, have you been in close contact with anyone who has suspected or tested positive for coronavirus, either at work or school or any of your social activities? Do you have a fever or have you had a fever recently? And the last question is, do you have respiratory symptoms such as a cough or shortness of breath? After we've established that all the answers to all those questions are no, then we'll remind you your appointment is, for instance, tomorrow at 10 o'clock in the morning. When you arrive, let me tell you what to expect. First, we'd like you to arrive at your designated time. We're trying to space the appointments out so we have time to clean up and sanitize before each patient comes in. So please arrive at your time. There's not going to be any furniture in the waiting room. There, in essence, won't be a waiting room. We'll greet you at the front desk and then take you directly to the room that we're going to provide your care in. We would like it if only one person came to the appointment. Now we know that many of you have a caregiver that comes along, or a spouse, or a friend. We understand that. If it's possible, we'd like to keep it down to one person with each patient that's being treated. We have to maintain a specific number of people within the building at any given point in time. If there are other people, we'll ask them to stay, please, in the car. When you get in the building, we want you to maintain that social distancing. In fact, we have marks out in the lobby. Come in, stand on one of the X's. The next X is just a little over 6 feet away, so that we can move you expeditiously to a room, but keep you safe and ensure that you're not being contracted by anyone else that's in the building. If for any reason, prior to coming into your appointment, even after we've asked you these questions, if you feel ill or have any misgivings about coming into your appointment, that's fine, we understand. Give us a call. Let us know you're not going to be coming. We'll reschedule at a later date. We want you to be comfortable and for all of you to understand we're taking every possible precaution so that none of you become ill and no one from our staff become ill from the coronavirus. For many of you, you've been patients of ours, clients of ours, friends of ours for many, many years. For some of you who started as children, for a lifetime. You've become family. We know who you are. We know what you do. We know why getting this care is so important to your normal, even in this time of new normal. So we want to be here to help service your needs, help take care of what you need with these slight changes in the way we're managing your care prior to coming in and when you arrive here in our building. I want to thank you very much. I appreciate your understanding of the changes that we've made for all of us. If there's anything we can do to improve, please let us know. We'd like to learn from you. You can learn from us. We'll get through this together. At some point in time, we'll have a new normal where we don't have to go through all of these steps. But for now and for the foreseeable future, let's go at it this way. Let's see if we can't get you what you need, take care of your needs, and keep everyone moving to a better place. Thank you.